In this episode of the Nurse Practitioner Podcast, Lisa Bonsall discusses reflections on 2020 and using our voices to drive change. Can you describe your background and current role in nursing?
Hi, yes, sure. Thank you for having me today. So I'm the clinical editor for Lippincott Nursing Center, which is a professional development website for nurses and NPs in any stage of their career, from student and beyond, including all the twists and turns that a career in nursing can take. We host all the Lippincott nursing journals, as well as clinical and professional development resources. So my role is to create and present content valuable to nurses and NPs in any role or setting. My clinical background is in critical care. I was an RN in the medical ICU for many years before becoming a women's health nurse practitioner. Currently, I volunteer in a nurse and NP-run clinic for the uninsured and underinsured in my community, which has really been eye-opening. Community health is a whole different ballgame than acute care, and the need for healthcare and health education was never more evident to me than now. And more recently, I've started volunteering in our local vaccine clinics, which has really been rewarding.
What has the past year been like for you?
I don't think there are adequate words to describe the effects of the past year on anyone. For me, I've been really lucky to continue working in my clinical editor role. There's been a real need for nursing educational resources as nursing schools had to pivot to online formats, and nurses and NPs have been maxed out. More hours, more stress, the acuity of these patients, and the fear of the unknown. So in my role, we've really been working hard to deliver information to our members to keep them up to date on the latest research and trends and management of COVID-19, and also presenting opportunities for them to keep up their continuing education. As you know, in-person conferences have been on hold, and clinicians just haven't had the time to search for other methods to maintain their credentials. So like everyone else, we had to pivot, has that been the word of the year or what, and get creative in how we would reach nurses and NPs and meet their needs. In another respect, it's been really hard to not be at the bedside. As nurses, as nurse practitioners, we're used to running in to help when there's trouble. So it's been really tough to kind of be watching from the outside. Even the clinic where I work, we closed down for several months, except for phone consults and medication refills. So I really did feel helpless and wanting to be part of the fight and part of the solution. When we did open the clinic back up, wow, the need for education was so incredibly clear. We were screening patients at the door, and so many came in and they just had classic signs and symptoms of COVID. They would come in and just say, it's really weird. I can't smell anything anymore. And they didn't know that that was a classic symptom of COVID. So then we were trying to hook them up with testing, and that was very challenging. So, that was really eye-opening. And now what we're seeing in our patients is that the food insecurity is a real problem. They're out of work and they're just, they're running out of food before they get that next paycheck or unemployment check to be able to buy their supplies. So it's we're seeing the effects kind of outside of the hospital because that's the setting that I'm in. The other thing was, just watching my friends and colleagues fight this battle in acute care, putting themselves and their loved ones at risk. It was just really hard watching my friends, even my orientees from back in the day, these young nurses that I precepted who now are senior nurses in the ICU, and they're spearheading their COVID units. My husband is a respiratory therapist, and he's been working outpatient in a clinic for 10 years, but he was back in the ICU for 10 months and, back to working 12-hour shifts and just, dealing with these COVID patients who are so sick and trying to manage their ventilators and just seeing the stress and, him coming home and having to find that balance to get some rest and relief, but also protect the rest of us. So I was really proud of everybody, fighting so hard, but I really felt this urge to be by their sides, helping in the fight. Fortunately, they didn't need me. I did apply to help, but my help wasn't needed. So that was fortunate for them. They had enough staffing. But later on, more recently, when I could get involved with helping with vaccinations, I have. And it's been really rewarding. People are just so so incredibly grateful that we have, another tool in our pocket to fight this pandemic.
What does resilience mean? Is resilience a realistic goal for nurses and NPs?
Resilience. We hear that word a lot lately. I feel like it's kind of becoming a buzzword similar to compassion fatigue or burnout. To me, resilience means being able to face challenges again and again and getting stronger all the while. And for sure, nurses are resilient. Nurse practitioners are resilient. And there's been no test of resilience like COVID-19. I worry, though, that we may be doing a disservice by setting this expectation that it's the clinician that must be willing and strong enough to keep facing adversity and keep fighting this battle, or even setting the expectation that an individual is responsible for maintaining or achieving resilience. I think there comes a point where we have to be okay with saying we need help. We need support, we need the resources to achieve and maintain our resilience. So is it a realistic goal? I think so, but not without the right resources from our institutions and administrators. I think we have to be careful using that word, along with, the terms I mentioned before, burnout, even self-care. It puts the onus on the individual that they have to resolve the issue or improve their situation. And how can we be resilient, especially now, fighting COVID-19? This battle is not over. We need the right resources in place to do our jobs and to protect ourselves and our patients. And this has to come from our work environment. Clinicians on the front line have been putting their physical and mental well-being on the line each and every day. Add in the acuity of the patients, witnessing patients dying without family and friends nearby. Nurses and the NPs in the units have had to be surrogate family members and stay with patients, as they're dying. And we have to become resilient. Yeah, we don't have a choice, but we need help. We need support. And then, I think about the stress of these clinicians watching people on the, I'm doing air quotes, on the outside, people who are questioning the reality of this pandemic, people who don't, are disregarding the important role that we each have to play as individuals to put an end to this pandemic. Our clinicians are at risk, and they need to be and they need to feel valued and supported. I do think these experiences will be transformative. I think we have to look for ways to incorporate them and add to the meaning of our lives and of our work. But like I said, we're still facing a harsh reality. We're going to come out on the other side. Nurses are strong. We always do. But, like I said, we have to have support, resources to do our jobs correctly and safely.
What advice do you have for those considering a career change in nursing or those considering a career in nursing?
I absolutely love this question. There's nothing like being a nurse, like being a nurse practitioner, being able to be there for people at their most vulnerable times. I'm someone who sees it as more than a job. It really is a privilege. And what amazes me is how many different opportunities there are. I think even people who are nurses, who are NPs, or those aspiring to join the profession, they don't even realize the opportunities that are out there. I never knew I could be doing what I'm doing now. When I was back in school, I never thought I would not be at the bedside full time. I never imagined working in publishing and, developing professional development opportunities to support clinicians. It's really been eye-opening. And then I see what other people are doing in research and education. Part of my role as a clinical editor is talking to nurses, talking to nurse practitioners. And I always ask them, share your nursing journey with me. And it amazes me because so many have these incredible stories, and they all say, I never imagined I would, I always thought I would be a pediatric nurse. I never imagined I would be, a hospice NP or, I feel like we have to be open to all the opportunities and really, be aware of what's out there. My advice would be talk to other people. If you have the opportunity to shadow someone doing a job that you're considering, definitely go for it. Pursue your dream, but always be open to new experiences. Someone once said to me that sometimes other people see in you things that you don't see in yourself. So that really stuck with me because it's true. And I never would have pursued this role as a clinical editor if someone didn't say, hey, why don't you try writing? Why don't you try getting involved in some journals or, explore that opportunity? I say when someone asks you to join a committee or take on a new responsibility, try it because you really don't know where it's going to lead.
How can nurses and NPs use their voices to drive change?
Great question. As you probably know, nurses have topped the list for the most honest and ethical profession for decades. And this really validates our level of respect from the public. Many of us realize already how our voice resonates, especially now. The questions from family and friends seem to be pouring in. I'm constantly being asked about COVID, about vaccines. Can I travel? Should my kids go back to school? It's really evident to me that our voices are important. And I have noticed an uptick in the number of nurses and nurse practitioners who are being interviewed by the media, which is great. But I think we have to do all we can to keep up the momentum. I encourage everyone to stay informed on how we're being represented in the media. Seek out opportunities to share your story. Seek out those opportunities, but also be open when someone asks you to tell your story, whether it's in your institution or somewhere in your community, or even on a national or global stage. Speak up. Share your work, especially now. The innovations that nurses and nurse practitioners have developed over this past year are amazing. We're troubleshooters. We find a way to get the job done. And I think that we really need to share how our work impacts health and how many roles we have. The other way to share your voice is social media, which really is a powerful outlet to inform and educate, but definitely use caution, always be respectful, maintain professionalism and privacy. And then lastly, I encourage everyone to write for publication because, that's the field I'm in, and I think it's a great way to document your experiences and share your knowledge.
What role do you see nurses and NPs having in the future of healthcare?
This is another good question. As clinicians, we know that certain communities are impacted differently by disease and infection. We know that racism itself is a public health issue. But I think it's important that the public knows that as nurses and as NPs, that's part of our training to assess and always be reassessing those social determinants of health. So the neighborhood and built environment, security, prevention, education, and economic stability. We ask those questions. We take the histories and we're always asking patients, okay, so where do you live? And who do you live with? And what kind of work do you do? And what's your community like? And where do you get your food? And, we're always asking, we're extending that plan of care from just the individual patient and including, their family situation, their community, all those social determinants of health. It's what we do every day. So I think that we definitely, have a role in the future of healthcare. COVID has certainly changed the landscape, but we're positioned to extend our impact beyond the clinical setting. We have to continue to be an example to those around us. Our education and experiences, are unique and they make us instrumental to move healthcare forward. And we have to hold ourselves accountable, our leaders accountable. But I do think that the future of healthcare depends on us. We have a big role to play. We're team players. We look at the whole picture, and we have to keep up this momentum to make sure our voices are heard and that change happens. Lastly, I want to say to all the listeners, this is Nurses Month, so happy Nurses Month. I hope that you're getting the recognition that you deserve. Stay safe and be well. And I think you're amazing. I know you're amazing. You're doing incredible work, and I just wish you all the best.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.